Thank you. Dobry den. Good morning. So yes, now I'll try to present how Brussels see the integrated care. First, I will say a few words how we perceive, or what's the definition we use to talk about integrated care. Then I will give some reasons why in the European Commission's opinion this is an important topic, and also how we try to support member states in going towards this solution, this way of providing services. This is the definition, of course, one of many definitions that are around. It's taken from the reflection process on modern, responsible and sustainable health systems. That process lasted between 2011 and 2013. It was driven by the member states. There were certain subgroups. One of the subgroups reflected on integration of care. So as you can see, integration of care or integrated care, there are initiatives that seek to improve outcomes of care, and they do it by overcoming issues like fragmentation, linking or coordinating services of providers along the continuum of care. So basically what you already heard today about issue of for example, of dealing with silos in healthcare provision. The integrated care has this triple aim. So it's to improve individual experience of care. This is very important when we talk about patient or person-centeredness. It's to make people who receive care feel comfortable with the way care is provided. It's to improve health of populations. We've just heard about efforts going to this direction. Naturally, health of populations will improve if health of individuals will do. And it's also about money, about reducing per capita costs of care for populations. We all know that financial aspect of functioning of health systems is important, even if we don't have here representatives of ministries of finance. When we leave the room, we will have to face reality. This is a graph from the OECD's and the Commission's publication Health at a Glance 2018. It presents statistics, information about health status, about health systems in the European Union. Just to show you, but we already heard about chronic diseases. So the red arrow points to main causes of mortality in the EU on average, and the green one in Slovakia. So as you can see, vast majority of deaths are caused by diseases like circulatory system diseases, cancers, which also become chronic diseases. And only adding those two, but also respiratory system diseases, we clearly see that chronic diseases are the main cause of mortality in the EU. Talking about money, these two charts present, so here are the costs of healthcare, and here you have costs of long-term care. And as you can see, once again, the colors, green for Slovakia, red for the EU. In case of costs of healthcare, this gray part is a prediction until 2070. As you can see, the costs of healthcare probably won't rise much in all EU countries, relatively won't. But if we look at the costs of long-term care, which is part of or also a care that we have to provide to people, especially people with chronic diseases, you can see that the rise will be almost, the cost will almost double. So this is financial reason for being interested in integrated care, which should decrease costs of providing care. This is part of this health at a glance report. So as the finding, the report are not only numbers, there are also findings, analysis. So the finding says that population aging, all countries face it to lesser or greater extent, requires profound transformation in health systems. This is why we say that integrated care is a new way of providing services. It's something bigger than just slight changes in medical practice. It is about focusing more on integrated people-centered care in community instead of providing acute care, which is the consequence of rising burden of chronic diseases. There are countries that began going to this direction, they began their transformation, but for sure there is still a need for much more efforts to make this transition ongoing and to cause that it has long-term, to recognize that it's a long-term care effort in order to achieve its goals. So that was, let's say, more general view, also commissions, but also OECD's. This is purely Commission's opinion. It comes from the communication on effective, accessible, and resilient health systems. The communication was published more than 5 years ago in April 2014. Since the title is about accessible and resilient and effective, accessible, and resilient health systems, it's obvious that the actions in that communication are divided into those 3 pillars, and especially when we talk about strengthening effectiveness of health systems, integration of care steps in. And by effectiveness, we mean ability of health systems to produce positive health outcomes, so to improve health of the population. We are coming back once again to the triple aim of integrated care. Last year, also in April, month of communications by the European Commission, the other communication was published on health and care in the digital single market. In general, is to recognize that digitization influences various areas of our lives, including organization and provision of health and social care. This communication, once again, has 3 pillars. One of them is digital tools for citizen empowerment and person-centered care, which is, in other words, integration of care. So these tools should help member states to build and improve their know-how and capacity to implement new care models, so to implement integrated care. How the Commission does it? So here are only a couple of examples of our activities. So online resource center for integrated care, workshops we organize, and also initiatives that are co-financed or financed by the EU Health Program. So this is the screenshot of the Health Integrated Care Resource Center. It's available on the Health Policy platform. You have internet address here. So the Resource Center could be an entry point for those looking for information about integrated care. In this resource center, we not only provide with information produced by the Commission, but also you can find link to publications, reports, etc., produced by other organizations, by countries, etc. And the content is divided into few categories relating either to implementation of integrated care or to different types of activities in this regard. Workshops. So last year in Utrecht and the year before in Dublin, during international conferences on integrated care, the Commission organized so-called implementation rooms. The overall topic of those events was how to design and implement integrated care, lessons from early adopters in Europe. The logic was, since we assume everyone in the area, in the health and social care sector knows that we should go towards integrated care, there is an issue of this implementation gap. We know that we should do it, but do we know how to do it? So that's why we came up with this idea of inviting countries, regions that are well advanced in integrating their care and healthcare systems to share their experience, also not only success stories, also failures in their actions, to enable those who would like to follow, to have first-hand information what they should and what they shouldn't do. So you can see these are some of the topics that were discussed. So, for example, change management, political engagement, more technical like ICT, infrastructure and solutions, workforce and patients education and training, and so on and so forth. This year in San Sebastian, also during the International Conference on Integrated Care, we changed our approach. So we organized workshop and marketplace on capacity building and technical support for implementing integrated care. So first there was a workshop where demand side, so authorities that would like to integrate their systems, and supply side, so organizations, experts with knowledge, with capacity to transform health systems. They presented, I mean, demand side presented their needs and supply side presented their offer, their experience with helping health authorities in transforming health systems. And after that, there was a marketplace, a dedicated area where both sides could sit together, could discuss in details their possible cooperation. Talking about other initiatives, those financed or co-financed by the EU Health Programme, probably I can skip that slide, since you heard at least a few times about SANTE Exchange. So the project, and you will hear more in the afternoon. So this is the project aimed at supporting regions in adoption and scaling up of integrated care. It's to facilitate access to evidence-based assets on this topic, and also the main result of this project would be better access to evidence and to tools that are available to potential adopters, so those who would like to transfer their systems. There is also a similar project called Vigor that also has an overall aim of enabling exchange between experts and experienced regions experienced in integration of care, transformation of health systems, and those who would like to follow. The Vigor project is to understand and guide 15, that's the exact number, care authorities, and to increase their systems capacity and capacity building to implement integrated care. Those authorities, those regions will receive support in focusing on integrating care, making it operational, preparing for implementation of some chosen good practices, and also as a next step after the project in rolling out those practices, so rolling out or scaling up, making them more popular, more visible in their systems. This is proposed joint action, so something that we hope will take place. It's also on implementation of person-centered care, to be exact, digital person-centered care. And once again, this action, the difference between projects and joint actions is that in joint actions, we have representatives of member states, meaning member states at the national level, probably I should have mentioned it before, many things in the area of integrated care happen at regional, local level. It's probably also because there is a need of, apart from sophisticated ICT, apart from legislation, to make integrated care happen, you need trust, personal, direct contact between different players in the system, including patients, their organizations. And obviously, in a smaller area, in a region, it's much easier to do so than at the national level. But we think that there is a need also to raise awareness about integrated care at the national level. So that's why this joint action is to reinforce, once again, to reinforce capacity of health authorities, in many cases, ministries of health, to transform their systems. Sorry. And also the joint action would give an opportunity to transfer best practices. There are 4 best practices selected from the Basque Country, from Catalonia, from northern Denmark, and from Germany. And the next adopters, as they are called in this context, so the authorities that would like to transform their systems, they will have an opportunity to take either the whole practices, knowing that there's no one size fitting all, or bits and pieces of those initiatives in order to transform their systems. Dziękuję. Thank you.